Howdy ho, you two. Let's talk extractions. Still have a little bit of a hard time learning how to speak. My first extractions were when I was 21. I can't remember if it was one tooth or two. I think it was just one, and it was my wisdom tooth that started this whole disaster. I never had any cavities until I had my first baby, and that wisdom tooth got cavitied. It was like my body just couldn't handle my very high risk pregnancies, and my body just couldn't handle all the things it was supposed to take care of. So my teeth were one of the first things to be compromised within my body. So I had my wisdom tooth extraction when 15 years ago, when my 15-year-old was a pretty new baby. And then I had a bunch of extractions. I can't remember exactly how many it was. I think it was 8. When my 7-year-old was new. She was just a few months old. She was pretty new. And then I had one extraction a couple years ago when I was pregnant with my almost 3-year-old. I forgot about that one until yesterday. I had a really bad abscess, and I was just like, please just pull it, and he did. So by the time I did this next set of extractions, I pretty much knew what to expect. I'd done this a few times. When I had my big batch of extractions, when my 7-year-old was a baby, I said I did it under local. I went to an oral surgeon, and I had the choice of doing general or local. And I chose the local because my husband had to work, so I had to drive myself there, and I had to drive myself home. So general really wasn't an option for me. It was awful. Oh my gosh. So to do it and pat my mouth with gauze, and I'm like, bye-bye, see you later. And I had it done like 70, 80 miles away from home, because where we live, there's not a lot of that stuff. So I'm driving down Route 1 through Northern Virginia, and there's just blood and saliva pouring out of my mouth, all over my shirt. It was so gross, and I had to stop at Walmart and go buy a new shirt because I had to go pick my kids up on my way home, and I wasn't about to walk in there looking like I'd gotten in a fight. I mean, I was just covered in blood. It was bad enough walking into Walmart like that, but, Woodbridge area, pretty normal. Not that shocking. So, anyway, so I said I would never, ever, ever do it under local ever again, because it was just like, oh. And then the affordable dentures that I went to in Woodbridge, they only do local. So it was either do it with the local or we're not doing it. So I did it. Now, my husband was in the waiting room. He drove me. That made a huge, huge difference. I have a very new nursing baby who I couldn't just leave. So my husband came to hold the baby, and so that I could nurse her right before and right after the work was done. And knowing that they were in the waiting room really helped a lot. So it comes time for them to do it. They take me back, and I'm waiting, and okay, so we're ready. We're gonna do, So they did the Novocaine, which honestly is the worst part. And it's really not bad. Like, getting your ears pierced is worse than getting the Novocaine shots in your mouth. So if you're afraid to go to the dentist because you're afraid of the Novocaine shots, seriously, just stop, because I promise you've been through way worse things than that. I said, getting your ears pierced hurts more than that. I've had natural childbirth twice. I've had kidney stones. I've had kidney infections. I've had catheters. This was nothing compared to that. So to do that, the worst, it stings for a minute, and it sounds weird. Like, you can hear it piercing the wet tissue in your gum. It's weird. That's weird. The worst part of the Novocaine is the taste. As they're doing it, it kind of squirts out, splatters out all over your tongue, and it tastes worse than vomit. I was really thankful the dental hygienist who was working with the dentist who was working on me I would start to heave as I started to taste it. And she'd suck my mouth out. And then she would take the water and rinse my tongue off and then suck it off. And she'd do that 2 or 3 times to get the taste out of my mouth. It was lovely. I loved her. So then I started from here and they worked their way around. And my teeth were not loose, so it was not easy. It wasn't like they just kind of tugged in. Oh, here it comes. No, they were in there. They were in there really well. My body was killing them, but they were in the bone really well. Which I guess means I have healthy bones. I hope so. So they would tug and tug and tug and tug. And then when it finally breaks loose, you can hear it. And I can't even describe the way that sounds. You hear the root break free from the bone and pull out. And then you hear it go clank in the cup or the pan or whatever it is that they're putting it in. So, and some of them were really more difficult extractions because most of the tooth was gone and it was really broken down and really decayed. And like sometimes they'd be pulling and pulling and pulling and pulling with their tools. And when they would kind of twist at the tooth to try to loosen it up, and you'd feel the bones in your whole face. She's twisting right here. And I'm feeling like my head's going to pop open all the way up here. Freaky! No, it was so weird. Or like, I would feel like my jaw was going to snap. It was like I couldn't feel the pain. It didn't hurt, but it was like pressure. Weird feeling. And sometimes the tool would slip and go thunk in the bottom of my mouth. And that kind of freaked me out because I was like, don't break my other teeth, no. But it was all good. So then they were all done. They packed it with gauze for a few minutes. And they went and got my denture. And they painted the stuff on it. It was like toothpastey some kind of cream that somehow, even though I couldn't feel anything, it would show them where it was rubbing on the gum. So they painted the stuff on there and shoved it up in there and pulled it out and then went back and adjusted it, painted stuff. And they did that like 2 or 3 times. Then they were like, okay, you're done. Congratulations. Well, they didn't say congratulations, but they should have. And that was that. So if you can do it general, I recommend it. If you can't, there are definitely worse things. I've had toothaches that are worse than that. Like there was this one tooth that she had to numb up a few times. It just wouldn't go dead. And it still, even once, it still hurt a little bit. And she was like, do you want more stuff? And I was like, I've had toothaches worse than this. This is nothing. So that's my extraction experience. And my next video, I will talk about how my sockets are healing. It's a little different this time than my last extractions because I have no teeth on the top to hold my bite up off of my gum when my teeth aren't in. And let me tell you, taking your teeth out is a weird experience too. So, bye for now. Bye-bye.